can go ahead and get started. So I'll go ahead. So, hi, everyone. Thank you all for joining us. We're going to go ahead and get started here as folks are still trickling in. So, as people are trickling in, we're going to do a few housekeeping items real quick. As a reminder, please go ahead and mute your lines if they're not muted. So there isn't noise in the background as our presenter is presenting. And also, we will have time for questions at the end of the webinar. If you have any questions during the presentation, please go ahead and write them in the chat box, and I will read them out loud at the end for to be answered at the end of the presentation. So just go ahead and write any questions you have in the chat box. If you have any tabs open that you aren't using, those tabs, this will help us save bandwidth during the presentation. And a final reminder that this webinar is being recorded and will be uploaded to our website after this presentation. I will also send it out in a link after the presentation, probably early next week, for folks who want to kind of go back and revisit. So I will go ahead and introduce our speaker for the afternoon or morning, depending on where you are. So this is Dr. And I apologize if I butcher it, but had a couple minutes to practice. Buitron de la Vega. He is a general internist and preventive medicine provider with a longstanding interest in patients' attitudes and beliefs about health, healthcare, and their health-related social needs. He provides clinical care to a majority of Hispanic patients, an underserved population in healthcare. Dr. Buitron is also a program director of the Boston University School of Medicine, Preventive Medicine Residency, and an assistant professor of medicine. He is the clinical lead for Thrive, a clinical strategy that systematically screens for health-related social needs in all patients that present to primary care and refers them to resources when requested at Boston Medical Center. Additionally, Dr. Buitron is passionate about patient-centered communication and using mind mapping to develop interventions that can improve communication between patients and their healthcare providers. So with that, I will leave it off at hand it over to Dr. Buitron. Take it over from here. Thank you again for being with us and agreeing to present today.
Yes, thank you. Welcome everybody to the presentation. I'm very excited to talk to you about two projects that we've been working on at the Boston University and Boston Medical Center. My name is Pablo, and I'll be talking about how we've been using virtual reality and virtual worlds to start teaching about social determinants of health. And before we start, I don't have any disclosure of conflict of interest related to this presentation. There are two companies that we work in developing the virtual worlds, virtual environments. I don't work for any of them. They don't pay me any type of fee for any of this work. So first, let's define what social determinants of health are. So these are the conditions in which people are born, they grow, live, work, and age. And these conditions are shaped by the distribution of money, by the distribution of power and resources at global, national, and local levels. And these are the major drivers of health and disparate health outcomes across our communities and our populations. And if you're exposed to good social circumstances like having access to good education or food, that's going to make you more likely to be healthy and thrive. But if you're exposed to adverse social circumstances like food insecurity, homelessness, you're gonna be less likely to have good health outcomes, good health. And it's very important when we talk about social determinants of health to talk about racism, because it's not race that it's an adverse social circumstance for you. It's racism. It's exposure to racism that is the adverse condition that is going to make it difficult, very difficult for you to achieve good health outcomes. And this is that it's important to define. And in order to address social determinants of health, it's relevant to remember that these social and environmental conditions determine 50% of our health. Is very high. The clinical care that we do in our hospitals is only 20%. That's why it's so important to really understand not only how to address this, but how to teach them. In this graph, you can see that in order to address social determinants of health and social needs, you can approach it in at the different levels. And the community impact is where it's going to have the biggest impact. We all know that we have to really put resources there in changes in policy, in changes in the structures of our community. That way, we will prevent social needs to ever happen. At the same time, while these changes and while we are able to achieve these changes, we have to have interventions on the individual level because we're safety net hospitals and we really need to help our patients. So in Boston Medical Center, we have a process of screening for social needs and referring patients to the different resources. And that is called Thrive. And when we implemented Thrive, we found that a lot of the trainees that were coming to the hospital didn't have adequate understanding about social determinants of health and about poverty. And they also didn't know how to use these tools that we created to address social needs. And that is how, as a school, uh, Boston University Medical School, we find out that we had two major gaps that we really needed to approach in a better way. One, there was a gap in terms of knowledge and attitudes towards poverty in medical schools in general, and I'll talk a little bit more about that. And two is that there is a lack of skills to adequately explore and address social determinants of health at the individual level. And these are the two things that I'm gonna talk to you in this webinar. First, I'm gonna talk to you about this virtual poverty simulation that we did with the goal of improving knowledge and attitudes in our trainees. And then I'll talk about this virtual reality interprofessional simulation that we created to try to improve skills to address social determinants of health in medical students, physician assistant students, and social workers in a collaborative way. So let's get started with knowledge and attitudes about poverty. And as I mentioned, there's insufficient training about poverty. There's insufficient training about how poverty affects your health. And one of the reasons is because of the lack of exposure to this, but also because most of the majority of medical students come from high income families. And to understand poverty, if you have never been exposed to that, is something that is challenging. And just one lecture or one activity is not going to do it. So we really needed to understand this. And different things have been done in the past. One is the Community Action Life Poverty Simulation. This is the Community Action Life Poverty Simulation is a simulation of poverty that has been done in prior years. What happens is, as you see in the picture, the students or the trainees or different members that want to take part of the poverty simulation are allocated to different places in a big auditorium, to different families. So each participant is going to role play being a family member living under poverty condition. They will meet with their families, they will talk about what are the needs, and then they will be deployed in the same big auditorium to resource agencies that are going to help them with food, with housing. And these simulations are very powerful and they are very effective in improving the knowledge and attitudes towards poverty. They have been done in other medical schools. And when we started thinking about doing something like this in our school, we figured that the resources in terms of physical space, in terms of faculty, in terms of materials to run these simulations, were really massive. We really needed a lot of resources, and we couldn't really do this for the 160 students that we had as first years. So we started thinking about how can we use technology, how can we innovate in order to be able to expose our students to something as valuable as this poverty simulation. And we started thinking about virtual worlds. How can we make this that is being done live and doing it in a virtual space? And that's how this idea of creating a virtual world poverty simulation for our medical students first years at Boston University uh, Medical School came up. And what we decided is to first to create our team. And the team that was created at our school was four-year medical students and myself that we would develop the content, the storylines of the families and the logic of how the simulation was going to be. Then we decided to partner with Beardway. Beardway is mainly the platform and the virtual world that we use. There's many, there's other examples out there. Second Life is another one. And Second Life was actually used before we did this by a nursing school to try to do this. And we try to simulate something similar in this case with Birdway. And we decided to work with them. They help us develop this virtual world. So we partner, we got support from our school, from our center to do this. So I'm going to start talking, and mainly I'm going to concentrate in talking about the simulation. I'm going to tell you a little bit about the preliminary results. We just did this before COVID started, so we are still analyzing some of the results. So I'm going to share a little bit, but mostly I'm going to share of how this simulation actually happens. So this is the virtual world that we created. And so our team, the four medical students and myself, we developed this, we got this land in Birdway where we could build our community that we will simulate. So if you see here in the screen, in the upper left side, you have, those are the five families where the students will be allocated. So 4 students in each family will be allocated to each one of these ones. Then in the left side, you have a park there. Then below the park, you have the student or education office where the families can go and enroll their students in school programs or after school programs. And then in the right side, you have the housing agency where the families will go to find out how can they get support to pay for rent or apply for housing. In the middle of this is the health center. And the health center is communicated with the food pantry because in our hospital, we have our own food pantries. That was actually the first hospital food pantry in the country. So we wanted to simulate that. So it's right there next to the office of the healthcare providers. And in the top right side, you have the workforce development office, where if you were a family member, you would go there and try to find a job and try to find this. So overall, a big picture is the students will get a role of a family member living under poverty conditions using their laptops. In this case, they were accessing Birdware just using their laptops in this virtual world. They were not using VR sets. It was mainly through their laptops, and they would be assigned to one of these family houses. They would meet with their other students that were part of their families, and then they would be deployed to these different resources places to get some of these information and some of the resources. So 1 week in advance, the student will receive this that you see in the left side is the handout with information about your family, about your role, about your member. And one unique thing that we added here, if you can see, is the area of I feel most proud of. Unfortunately, when we teach social determinants of health, we only teach about the adverse social circumstances. But patients and people in general, they also have assets. They have things that they feel most proud of, that they need to hand on to really improve their lives. So when the students were reading this, we will give them this section where they, in this case, this family member felt most proud of being a single mom and being able to take care of the kid. Besides the email with this information, we also created 2 to 3 minute videos with information about the family and about the member, so they will be more engaging. So this will be, I'm just going to play a couple of seconds of the video.
Meet the Johnson family. Over here on the right, we have Kiara and her daughter Alyssa. On the left is Kiara's sister Jasmine and Jasmine's son Joshua. Thank you for watching this video to get to know the Johnsons. Their story begins 3 months ago when Kiara left her home in New Hampshire. Her ex-husband was put in jail and no longer paid child support, so she was unable to afford her housing. She packed the bags and she and Alyssa got on a bus headed towards Boston. Jasmine told Joshua that his cousin and aunt would be living with them for a while in Boston, and at first he was hesitant to want to share his space, but before they knew it, Kiara and Alyssa had arrived. Jasmine continued her daily job as a certified nurse assistant and was excited to be reconnecting with her sister, but she quickly started to feel the financial strain of having more people in the house to support. Joshua has been sleeping on the couch so Alyssa can have his bedroom. He is a junior in high school and has moderate persistent asthma. He does not always take his medications as prescribed, and he has been hospitalized multiple times, causing him to miss a lot of school and fall behind on schoolwork. Jasmine and Joshua are also coping with the unexpected loss of Joshua's father last year. They are both still mourning, and Joshua quit the basketball team to work after school as a cashier to help his mom with expenses. Joshua needs to go to the doctor this week to discuss his asthma. He also would like to find a tutor at school to help catch up on the work he missed from being in the hospital. Joshua is interested in rejoining basketball, but he's worried about how the other players will treat him since some students at school recently found out he is gay. Jasmine would like to join Joshua at his doctor's appointment to make sure she understands his medications. She also wants to see her own doctor to talk about quitting smoking. She's interested in seeing if the community health center can help her with her bills, particularly the high medical bills from Joshua's hospitalizations. Yara had a great job working as a
So that's the way that the students will better engage with their family member. We really wanted to create something that would be much more engaging, and the medical students were great creating these videos. So this is a breakout of the actual simulation. So the first 5 minutes, and before this start, to make sure that the poverty simulator was working the day before and the week before, the students will have to go in the poverty simulation app into Beardway to make sure that they could work, make sure that their audio was working, make sure that everything was working, and that was something that was required. Then and during the simulation, the first 5 minutes, they will be allocated to their different locations and we'll give an orientation. So I will be giving the orientation with the audio, so everybody in the simulation will be able to hear. The way that we run the simulation, we ended up running 2 simulations every day from Tuesday to Friday. Each simulation will host 20 students, and each simulation lasted 60 minutes. And so every day we'll have 2 simulations. In the simulations, the key thing was how we orient the students to this. So we took those 5 minutes to make sure that the students get familiar with the environment, but also to make sure that they take this seriously. Because one of the worries that we had as a team is that they would take this as a game, and that was not correct. So we make sure that they understood that some of the students that were there could be also, and some of the faculty could be also having social needs as well, or struggling with an adverse social determinant of health. Then the students will introduce themselves to their individual family member. They'll say what they are most proud of. They'll meet each other, and then they will decide how the week will look. So they will take 15 minutes. They will go outside to the various service agencies to try to fulfill their individual need and family need. They will go back in their homes, they will talk again, they will plan for the next week. And then the next 15 minutes, uh, they will simulate a second week, and then they will come back to their homes and they will debrief with the facilitators. And mainly the debrief was about trying to ask them questions in terms of how did they experience poverty, how was this simulation for them. So I'm gonna pause there. I'm gonna share the screen of how the environment actually looks from the student perspective. Okay. So this is the Beardway virtual environment. Right now, because we are presenting it here, it might look pixelated a little bit, but the view is pretty clean. So now I'm one of the family members. If you see here, these are the different homes of the different family members. So when you start, you'll have to go in one of the houses. So for example, if I'm one of the in the Urbina house, I have to go in here in their house. So you go in, and your family members will be there waiting for you. You'll have the information of your family, you'll have your video. And once you've discussed with your family members, then you come outside to the environment to try to find the resources that you need for your family. So in this case, here in the right side is the park. Here, for example, is the food pantry. So if you go to the food pantry, for example, then there will be somebody there waiting for you that will help you with your needs. Now, in this case, you'll see down here, there will be a faculty member that will be facilitating this role. And the faculty members, we'll have a guide also of how to respond to each one. Because we didn't have a lot of time to train the faculty. So each faculty only had like a 5-10 minute training, and that was enough for them to be able to do this. So it was very effective. And then once they were done, they would go back to their homes. They would do the same thing 1 week again. So this is how the poverty simulator, the Birdway poverty simulator looks like. I'm gonna go back to the PowerPoint. So the way that we evaluated this intervention, we did a pre and post survey that was at the end completed by 123 students. We had a total of 160 students doing the simulation. 120 completed the pre and the post survey. I'm mainly asking them about knowledge and attitudes about poverty, and also their perceptions about the virtual poverty, this virtual world poverty simulator. And I'm going to share some of the results as we are still in the process of analyzing some of the data. These are preliminary results that we have here. So here, just to orient you in the graph, these are the questions that we're asked in terms of knowledge about poverty. For example, I understand how social factors impact a person's health. And these were Likert scale questions from 1 to 5. So the green is strongly agree. So one thing that I have to mention is that at baseline, our students already feel that they have a strong understanding about how social factors impact the person's health. So then the left column is their answers before the simulation. The right column is their answers after the simulation. So in this first trial, if you see question 1, question 2, and question 3 do show an improvement, but this improvement was not statistically significant. Where we did find improvement in terms of knowledge was in the participants' knowledge about resources available for somebody that is experiencing poverty. So that was statistically significant. If you see here in the graph, the green color increases a little bit more too, so that gives you an idea of that. In terms of attitudes about poverty, we also found two domains where there was a statistically significant improvement. In this case, medical students should explore patient social needs. Pre was already high, but in the post improved even more. And then question 8, that was medical students should connect patients to resources. So after the simulation, there was more agreement about this. So it's good that at baseline, the students really had good understanding and good answers, but that also improved. When we were evaluating the qualitative piece of this in terms of the open-ended questions on the post survey, we did find that some students had some comments that were negative about the poverty simulation. For example, some students, it was the minority of students, but some students said that we shouldn't be trying to simulate poverty, because poverty is something very hard, and it's something that we shouldn't be trying to simulate as a game. And we started thinking about why some students, and there were some other comments that would be the students saying like, I live under poverty, and this exactly really shows my experience. So it was great. So the majority of students felt that it was good. But one thing that we found from the qualitative data was that we thought that some of the students that have experienced poverty, or that have served poverty patients that live under poverty conditions, those might be the ones that didn't get a lot from the poverty simulation. And we did a preliminary analysis of that I think that's the most interesting finding for me that we have now. So here in the left side, you have the stratification that we did with our data. So we stratified our students in students that have never cared for patients in poverty, and students that have never experienced poverty before. And if you see, it goes all the way to students that have cared for patients in poverty and that have experienced poverty themselves. And we find something extremely interesting, that there was a statistically significant difference in terms of how students value the poverty simulator if they have been exposed to poverty or not. So here, the higher numbers, if you see the means here, the means and the standard deviation. So a higher mean means that the poverty simulation added more value. So we found that students that have never experienced poverty were the ones that really found the most value of this. And the ones that have care for patients had find it less valuable. So that was very important because our goal was really to be able to teach and give the experience of poverty to students that might have not experienced that. So that's something that we found as well. So what are the next steps now that we have done this first? One is the storylines. The storylines that we created, even though we put a lot of social complexity in the stories, one thing that we saw in the poverty simulation is that a lot of the students were trying to go directly to the healthcare office to try to get their illness taken care of. And so we need to make a change so that the social need will be stronger and social need will be something that the students will really have to do first, will have to push them to do first. Because the idea is that they understand that sometimes if the patient don't comes to their office, if you're a student and you're seeing patients and they don't come, the idea is that they understand what's happening in the community. Maybe they didn't come because they had to get food for their families or they had to get housing. So that's the idea. And it happens some of the times, but some of the times they were just going right away to the doctor. And that's something that we debrief during the simulation as well. The other thing is this breaking news section that we want to include. So once we finish the simulation, in terms of simulate the power and the potential of structural changes, what we want to do in the future is finish the 2 weeks of the simulation and do this breaking news where there's policies that have implemented so that everyone has access to healthcare, everyone has access to housing, so they can experience what it could actually be if you're able to make those changes in the community and if you're able to make those changes in at the policy level. Then there's things that we need to improve from the virtual world as well to continue working with Birthway to make it more seamless to have access to this. In this first simulation, the students were in the medical school as a pilot to make sure that they didn't need a lot of technical support, and they didn't. So now we feel confident that we can do this while the students are at home, and this will be something that we'll try in the next academic year. And the fourth thing will be the interprofessional collaboration. In this case, what we really want to try to do is to get collaboration with the School of Social Work and with the different community organizations to see if they can bring us their staff also to be part of the simulation so that they can help us with this. And we're still trying to think how to get the patients into this. And we are going to try to get patients to help us with the storylines as well. It's hard to put a patient that lives under poverty condition in a simulator because that we didn't feel that was okay. But we're still trying to see how we involve the patients as well in this. So I'm gonna pause there for before I move to the other simulation. I'm gonna pause there and to get questions about the poverty simulation before I move on.
Hi, I'd like to ask what it's like for the students when they're interacting with the services in the virtual community. Do they run into similar barriers that patients do in real life, such as, the waiting period between putting in an housing application and then actually getting housing and things like that?
Yes, thank you for the question. So the question goes back to besides simulating the storylines, the families, are we actually simulating what happens when if you're housing insecure, what happens when you go to a housing agency? And that was something that was very important for us to do, to make sure that the responses from the different agencies reflect what happens at the individual level in these agencies. For example, housing, there's the students in general don't have the understanding that here, for example, in Boston, if you apply for housing, it might take you 5 to 10 years to get a house. So when they see these patients in the clinics, they might connect them with a navigator or a social worker, giving them the expectation that, yeah, they're going to get the house. So what we did in this case, while we were creating the storylines and the resource responses, we did reach out to housing agencies to make sure that they tell us what are the most common problems that the patients have when reaching out to them. So for housing, the key thing that we, as knowledge, we wanted to make sure that they understand that if you apply for housing, it's going to take a long time and that there are not a lot of resources. And same thing, for example, for workforce development, what's the impact if you don't have an immigration status? What happens there? And same thing with the food and things like that. So that was something key for us, and that's why we did outreach to all these organizations to make sure that they bet our stories and make sure that they reflect the daily lives.
Thank you.
Thank you.
I think a couple other folks had questions in the chat box. I know Sarah Ferris asked about interprofessional collaboration, and has this worked in the past or not?
Yes. So the interprofessional collaboration in these specific poverty simulations, in the live poverty simulations, there usually is also there's a mix of faculty that they do it. In this case, that's our big goal for stage 2, to really collaborate with nursing school, with the School of Social Work, and really identify. We really have to sit down and think, where should they be? Should they be part of the family? Should they be part of their research agencies? That's something that we are definitely trying to do as the next step. Now, in the development of this, there was a lot of interprofessional collaboration between the School of Social Work and the different schools in the medical campus as well, and the community organizations too. You see the chat. Yeah, and going back to the nurses, I think in this case, one of the things that we are really trying to teach is that the addressing social needs is something that is in the scope of everyone, and it's in the scope of the healthcare provider, is in the scope of the social workers, in the scope of the nurse. Everyone should be doing something in terms of this. So the nursing collaboration is very important for us as well. Hopefully in stage 2, that's something that we're really going to try to do.
Wonderful. And just, for the purposes of, the recording, because I don't think this chat will be visible, I'll read that question out loud. And Sunny, if you wanted to follow up on your question, please feel free to do so. But the question originally was, it seems interprofessional collaboration with nursing would be very impactful, but you did not mention nurses as partners. Public health nurses, school nurses are valuable experts and allies. How have you considered this collaborative relationship? To which Pablo, you just answered, so thank you.
Hi, it's Sunny. I just wanted to chime in and say thank you for addressing that question. I'm from Villanova University, and of course, we're in Philadelphia. And I also work in a similar space using virtual reality and virtual gaming systems in order to educate nursing students and healthcare professionals. And so we've definitely found that leveraging the knowledge of nurses in the community, especially, has been very, very helpful. So I just want to make sure that you know that those relationships are really important, and that it would be so welcome to be able to work with people from all the professions in order to do that, and not just exclusively in our individual professional silos.
Yeah, thank you for that. And I think that's a nice thing about these virtual worlds, that now the physical space is not a barrier anymore. Because I think for us, we don't have a nursing school in Boston University, so that makes it hard. But with this, now we have the potential of that not being a problem, because we could do this virtually and there won't be a problem. So that's what these virtual tools also give you as an option. Excellent. So let's move on to the other simulation that I wanted to talk about. So we're gonna, as I mentioned before, there was this gap on exploring and addressing social determinants of health in terms of the skills that the students have. So in this realm, the medical students and the physician assistant students really lack the skills to address social determinants of health. They could ask some questions about social needs, but usually they're not trained on how to connect a patient to um, to a research agency, or how to do a consultation to a social worker if you, to a social work staff if they have an issue with a patient. And what we found when we started doing this work is that social work students do feel intimidated by these power dynamics that unfortunately still happen in our hospitals, where the providers between the providers and the different members of the teams, there's still that power dynamic. So, and unfortunately, during their training, they do have some opportunities for interprofessional collaboration, but not a lot. So that's something that we thought that it was something that we really needed to take care of. That's how we developed this virtual reality simulation in which medical students, physician assistant students, and social work students can collaborate and learn how to address social determinants of health at individual level, but with the scope of understanding what's the role of each one and how to collaborate between each other. So in this case, we collaborated with Continuum XR and the Immersive Health group. That they were the ones that were the ones in charge of designing and developing the virtual simulation with our guidance. So in this virtual reality simulation, what happened is that before the simulation started, we wanted to teach the students, medical students, social work students, and PA students about health equity and the social determinants of health. So that was a 60-minute Zoom meeting. Then we had another meeting where we talked about healthcare delivery systems and team-based care models, so they can understand a little bit of the history of how we work together and what happens and what are the different models. And then the last meeting was a meeting on how to use Thrive screening tool to explore social needs. So Thrive is mainly the tool that we have in our hospital that we use to screen all our patients for social needs. So we wanted them to be familiar with it before they actually practice using it in the virtual world. So that was those were the preparation before the simulation. So we recruited the students from these three different schools, and we recruited 5 medical students, 3 physician assistant students. There were 4 faculty there that would role play that would role play the patient, and 7 social work students that would be paired to the medical students. So we recruited this, and then we developed and we created an internal medicine hospital room that you can see here. This is a picture of how it would look. So to better explain this, I'm going to show you a short video, and I want to walk you through what this actually was. So right now I'm sharing, I'm going to share a video of what happens when you start the simulation. So we schedule meetings where the social work student will be in their campus. That's like maybe 5-6 miles away from our own campus, and then the medical student will be in our medical school campus as well as the faculty there. So the medical student will wear their goggles. In this case, we use the Oculus VR headset. So they will put their headset and they will be embedded in this virtual reality world. The faculty will do the same thing, will wear their Oculus, and then they will go in this virtual world, and the faculty will role play being the patient in this case. And then the social work student will wear their virtual reality headset, and they will be waiting for the student to finish to do this. So here, what you're gonna see here, so what you're gonna see here is the medical student there has their tablet with the Thrive screening tool there. They're asking questions to the patient in this case. And if you see, we try to develop the virtual space as close to the actual rooms that we have in BU. So I was going and taking pictures of the rooms, and that's something that was happening. So I'm gonna pause the video there 1 second. So if you see the medical student is, or the PA student is sitting in that chair, and then the patient is sitting in the bed. One thing that you're going to notice is that the patient has their full body, but the student doesn't have the full body. And this is something that I didn't know before I started developing this simulation with the team. But the evidence shows that if the students that are the main drivers of the simulation have the full body, that can get in the way and that can get really distracted. So the main thing that you want to make sure is that they have their head, I guess, and their hands, and that's all they need. But the patient that is the center of the simulation, that's where you want the full body to be. One of the nice things that you could do, because these students were working with us, is that you can change the voice of the faculty that was playing the patient, so that so that the students won't recognize that it was you. So right now the student is asking questions and exploring the social needs of this patient. This is a view from the different angle, so that you can see how it looks. That's the view from the angle of the student that is asking the different questions. Then once the student explore the social needs, they will go back to this room that is the consultation room. So the social work student will be waiting for them to have this conversation about social needs. So in the Zoom lectures, we taught the students on how to do a consultation to the social work students. So they will discuss, the social work student will ask them more questions about what this was like and about what are the things that they really need to ask more. They will have their discussion, and then once the discussion was done, and that's the view from the social work student. So the medical student will have their tablet and they will be talking about the different things. And this is where it's important in this case to mainly have the head and the hands so that it doesn't get too distracting. And to complete this full simulation, if you see that there's a clock there, they had around 35 minutes to complete this whole simulation, and then they will discuss about the different things. Then once they were done with that, they will go back to the patient's room. So if you see in this case, they were talking to the patient and discussing about the different things that they can help the patient. And in this part is where the we left it open to see who wanted to take the lead of the conversation. And sometimes, most of the times, the student and the social worker will go back and forward, and they will be asking different questions to the patient. So it was a nice collaborating space where they would do it. Once this was done, once they finished asking the questions and giving the faculty the different the patient the different instructions of what they can do, then at that point the faculty will change their role and they will be the debrief. So they will start a debrief about asking the students how did that go, what went well, what didn't go well, and then the simulation will be done. I'm going to go back to our PowerPoint slides. And we did those simulations. So we end up doing 7 of those simulations where we pair the medical student or the PA student with a social work student, and they were in different physical locations, and then they were doing this. The way that we evaluated this virtual reality simulation was by doing a pre-post survey, and to evaluate knowledge, attitudes, and skills to address social needs. We use the ICCAS. That's a tool that we use for interprofessional collaboration to see if there was any change there. But our goal was to concentrate in the focus groups. As this was a pilot and we had a very small number of students, the pre and post survey we were mainly using to test our tools so that we can see if we can use something like this in the future. So I'm going to share some of the preliminary results that we had as we did this in February. So in terms of the pre and post survey, I think the main areas where it showed a difference in terms of pre and the post, there was a statistically significant improvement in the medical students and PA student confidence in providing patients with social needs resources, and also collaborating with the social work around social needs based on this simulation. But remember, the numbers are very, very small. And yes, they are statistically significant, but this was a pilot study. In terms of the ICCAS, as a total tool, there was no statistically significant difference, but there were some domains that did highlight some differences, especially collaboration and team functioning skills were improved in the ICCAS tool. But going back to what it was more relevant to us to really explore and understand the perception of the students, I'm going to show you two quotes that really reflect on what we wanted to achieve and that the students really got from this. So one domain from doing the qualitative analysis of the focus groups was the opportunities for education and collaboration. So this is what social work students said. So for me, it was kind of interesting, like seeing how my role was kind of important for the medical student, and then seeing how their role is actually strengthened through our role. So for me, I like our collaboration. What was interesting is that all the social work students were feeling really empowered after this simulation in terms of their role, in terms of how important their role is in addressing social needs and improving the health care of the patient. And another, this is from the medical students, PA students. Expanding knowledge of social needs assessment skills and resources. That was the domain. For me, I think the biggest growth I have had in terms of learning about social determinants of health was in watching the social work students ask the patient questions and hearing the questions they had for me when I came to the consult initially. So a lot of the students were saying, oh, that was a very nice way of asking about housing insecurity. The way that you ask about food insecurity was very appropriate. It was very respectful. So they learned by watching the social work students do it. So this was very powerful. So next steps, we are working with the Immerse Health Group to use artificial intelligence algorithms so that we can replace the patient that was role played by us, the faculty, with an actual avatar that is automated. Because we want to be able to scale this up to all the schools. So we hopefully can make this a required activity for all the medical students and the social work students so that they can collaborate between each other. The other thing is similar at the other pilot that we did is adding other professions. As I mentioned, the scope of role of addressing social needs is in all of us, and not only from frontline workers in the healthcare facilities, but really in the communities. We really want to be able to create this collaboration with the pharmacists, with the community wellness advocate, with the nurses, with so many staff that are in the front line there to help with this, and really scaling up. We really want to. We're working in terms of where would this fit in the curriculum, so that more students will benefit from it. So before I finish, I really want to acknowledge a team. There's a big team that's behind this. For the virtual poverty simulation, the medical students were amazing in helping and in really taking the lead of this. I think these two projects um, and all the projects that I do always make me understand the power of trainees on helping us develop this. Because this is for them. We're developing this for them, so they need to be there. And that's why for me, for us, it's important to try to see how we can get more of the patient's voice into this and from other professions as well. And really, both teams in the companies that help us develop this, both Beardway and the Immersive Health Group, were very good on working with us and improving the things that we can do. And the virtual poverty simulation, that was sponsored by the Boston University School of Medicine and the Boston Medical Center, and the virtual reality simulation was sponsored by BU Digital and Learning Innovation, a grant that we had, and they have been really open on the second stage and how we can improve this. So feel free to send me any questions or about this. I'll pause to get more questions.
Wonderful. Thank you so much, Dr. Buitron, for your expertise and for this wonderful, informative, and just very interesting presentation, and for your time and for being here. And thank you to all the participants who signed in. I hope you are able to walk away with a bunch of new information and useful and apply that to your own respective work and endeavors. So I will go ahead and read the questions that we have in our chat box. It looks like we have one question that's been added since our last Q&A session from Sarah as well, who writes, I would like to hear more about the process of creating this scenario in partnership with the VR company. What are the steps? How much time does it take? Is there a way that we can all share scenarios with each other? Example, MedEd portal.
Yes, thank you, Sarah, for that question. It was a very interesting process. The first thing that I guess I'll quickly walk through the process. In this case, the first step is finding the VR company that's going to do this with you. We look at different companies and we decided to do it with this one. Then the next step and the most important step is to make sure that if you have the vision of doing this, you are the one that are meeting with the developers, because that was different in the poverty simulation. The medical students and myself, we were meeting with the developers from the beginning. So it was much better communication. They really understood what we wanted to do. In this second simulation, we did lose a little bit of time because at the beginning, it was mainly the VR company communicating with our funder, and that delayed a little bit of the process. Once I started a meeting with the VR company representative, then they really understood what I was trying to do and then move forward. In terms of the steps, so you need to develop a couple of things. One, you have the scenario that you have to develop. So in this case was for me, it was as simple as taking the pictures of the hospital bed and then giving it to the VR company. They will do it. Now the logic of how the scenes work, that was where we spend most of the time. So we'll have weekly meetings that we had for probably maybe a month and a half, 2 months, where we will both work together in terms of, okay, which one would be scene one? Should it be just the medical student and the patient? Should it be both of them? How would that work? And then that's something, and then they will give you the first pilot, and then they will show you, okay, this is how the first pilot look, and then you'll test it, and then you keep changing and changing it, and that's the other piece. And the other piece is really the storyline, the scenarios that we created. In this case, this was a Hispanic female that was in the hospital for uncontrolled hypertension, but it was mainly uncontrolled because she didn't have money to pay the copays, and then the student needed to find that information exploration. And our goal with all these different simulations is really to be able to share not only the story lines that we create, because it takes time, it takes a lot of thought, and it takes a lot of and our goal is to really start putting this in in places like Meded portal, where you can actually put the different things. Our goal is, once we have the poverty simulation at a stage that it can be used by anybody else, that's our goal, to put it in the Meded portal exactly how it is. Same thing with this simulation, but we're always open on sharing the storylines and other scenarios in these venues.
Thank you. Another question that came up from Sunny, technical questions. Who owns the IP? What platform do you use? Unity? Seems at the moment mostly for learning this evaluation a goal. Oh, for learning is evaluation a goal?
Yeah, so who owns the IP? That's something that is extremely important to discuss before you start this, because one of the things that we're trying to do is to make sure that when this is ready, that this could continue funding us to continue doing this work. So it's very relevant to discuss the IP ownership before you start this. So in this case, in both, the IP is shared. So for example, if the Immersive Health group there's another institution that wants to use this, then this is shared, and it's a discussion that we have to have with them. They cannot just share this without our consent. In this case, the platform that we use in the poverty simulation, it was the Birdway platform. In this case, it's mainly an app that Immerse Health Group created. So it's different because the Birdway is a platform that is out there, anybody can download. And we have our own world in Birdway that we created. But for this one, for the virtual reality, it's the virtual reality that created it. I'm not exactly sure which software they use to program it, but that's how we do it. And mainly at the other question is, at the moment, mostly for learning is evaluation and goal. I think that we have different goals, and the nice thing about this is that you can get other metrics. So besides evaluating the students' perceptions, the platform gives you data in terms of how many times did the social work or did the medical student interrupted each other, and other things like that that you can include as evaluation in the learning process as well.
Thank you. So another question that came up, do you have any recommended sources of grant funding for educational VR projects?
Yeah, so for me, it's been also an interesting path. I'm an immigrant. I'm from Ecuador, and because of my immigration status, that I have a visa here, I cannot apply to a lot of grants. So my strategy is mainly getting key stakeholders to understand the importance of this and to fund my projects, because I cannot apply outside. I know there's grants out there that you can. I'm not that familiar because unfortunately that's not even there for me. But that's why, like as leaders in this education, you have to develop your leadership skills of finding resources somehow. And our team was really good on really getting the key stakeholders in the Boston University to understand the importance and to fund the poverty simulation, as well as in the BU School of Medicine as well.
Thank you for sharing. Another question, looks like it might be the last question given the time that we have. Are these scenarios being crafted to be open source? How many Oculus devices do you have to run your simulations?
Yeah, so these two simulations are not open source right now. A couple of reasons right now. We don't think that they are at the stage where we can deploy them so that anybody can use, and we have our own struggles of trying to figure out how we make this sustainable. So that's why they are not open source at this point. Hopefully, we can figure out a way of doing it so that anybody can do. But the all the work that we've done to develop this is what the cost is there. So they are there. If for example the poverty simulation is there, if other institution wants to use it, they can feel free to talk to us and talk to Beardway, and we can figure out what the cost is. But the cost is very different from another institution because everything else has been developed. It's about figuring out what would be the cost, for example, of having to use the software, of having to use those things. That is much less, because we have already put all that upfront cost, but we really want others to use. So if anybody's interested on using some of our simulations, please feel free to reach out. And how many Oculus devices did we buy? We bought 12 Oculus devices so that each student and each faculty will have one for each one of the students.
Wonderful. Well, thank you so much, Dr. Buitron de la Vega, for your wonderful presentation. And again, to all the participants, who attended. We really appreciate those who showed up and just this moment for all of us to learn. Thank you again to all. This was a really great hour, I felt, and I've also personally walked away with some really cool info. So thank you all. I hope you enjoy the rest of your Friday afternoon and weekend. And also be on the lookout for an email. We will follow up with an email that includes to this webinar, as well as other sources and a link to our website. So that will probably go out in the next week or two, just depending. But otherwise, folks, thank you again for showing up and have a good weekend.
Thank you, everyone.
Thank you.